Medicare. So I'm going to talk to you about my program. My program is called VICAP, and just so you know, if you have a pen on you, this is the brochure that I handed out to you, and my program is called VICAP, and what I want you to do, the first thing I want you to do, is on the back of it, it says this is your local VICAP program. There were supposed to be labels on here, but I picked the wrong bunch of brochures. So my name is Rosemary. I'll spell it for you. It's Rosemary with an I. My last name is Walker, Walker. And my direct phone number, you will not reach anyone else because I'm the only one who does this at the county, is 703-792-4156. I also have email, but Medicare is really hard to discuss via email, but you're more than welcome to reach out to me via email and let me know you'd like to talk to me. My email is rwalker@pwcgov.org. .org, yeah. I do have a secured line, so if you call me and leave me any personal information, again, it's a secured line. Nobody uses it except me. Go ahead. It's 703-792-4156. So go ahead, sorry. I'm sorry. Brochure? Yeah, here. I have a whole bunch of them. I'll leave them on this table up here. So my program, as you can see on the brochure, is called VICAP. It's a really long acronym. It stands for Virginia Insurance Counseling and Assistance Program. This is a federal program, grant funded. So we get our money from the federal government, trickles down to the state, and then we get local. I don't think there's going to be any impact with the federal program cuts, but we just don't know, so we just, go forward. Basically, my program's free. Not basically, it is free. And we just provide unbiased advice or counseling to people that are on Medicare or going to be on Medicare, because it's very confusing. And I really think they try to make it confusing for older people just so we stop bothering them. So Medicare works with a lot of different programs, and it's not for lack of information, in my opinion, we're confused. It's because there's too much information out there, right? You get online, and there's so many things you don't know, and you're like, And then if you're doing it for yourself, and then you're doing it for loved ones, it's really complicated. So Medicare, again, I have to be trained. Isn't that good to know? I have to be recertified every year in Medicare. Free advice for people on Medicare, advice for people that are going to be on Medicare, people that have had Medicare for a couple years, people that have spouses on Medicare. The two groups of people that qualify for Medicare is anyone over 65, period, and anyone under 65 that's been disabled or deemed disabled by Social Security. So you have to have that deemed official notice. And those people don't get Medicare for 2 years. So if you have a child, and there's lots of children and people that have Medicare, that's because they have a disability. They normally deny you 3 times, so it's not easy to get a disability. Let's say, they won't give it to you, but you really should try. You have to have documentation, you have to prove why you can't work, or you can only work part-time. So that's who qualifies for Medicare. Most of my day is spent on the telephone or doing presentations like this so that I can make people aware of what my program can help them with. So for example, Medicare works with federal retirees, it works with Medicaid, it works with state retirees, it works with spouses that are working, that aren't working, it works with children, like I just said. So most of the stuff we're going to talk about, if you open my brochure to the first page, is basic Medicare. Basic Medicare has 3 components. It has A as an apple, which is the inpatient portion of Medicare. If you go to the hospital, they're going to bill A. Okay, so it's pretty simple. A is inpatient, hospital coverage. The flip side of A is B as in boy. That's outpatient services. That's doctors, labs, x-rays, chemotherapy treatments, colonoscopies, even the emergency room. If you're not admitted, it's going to be covered under Part B. Okay, does that make sense? So you have A, and you have B. The other, and this is called original Medicare, just so it's not confusing. The other component of original Medicare is D, D as in drug. It only covers prescription medication. Injections given to you in the doctor's office, drugs given to you in the hospital, over-the-counter medication is not covered by Medicare D. Only prescription medication you pick up at the pharmacy and you self-administer. So that's called original Medicare. That's what most people are going to call me about because it's confusing, the different parts. How do you pay for it? Who qualifies? How old do I have to be? What if I'm still working? So the majority of the calls I get are going to be from people that are probably new to Medicare. And I'll tell you about a PowerPoint you can also access when we're done here. The other thing people are going to call me about is D. D is very confusing. D's only been around since 2006. Prior to that, there was no drug coverage. So they have Medicare D is the drug component of your Medicare. Again, prescription medication only. All right. Another thing people are going to call me about is, and this is where it gets confusing, has anybody ever heard of a Medicare Advantage plan? It's called Medicare C. They advertise it all the time on TV. Never seen that one? Includes drugs, includes vision, includes dental. It's on a lot of off stations, I'll say, cable stations. They constantly advertise it. So there's a lot of people that think, oh, they offer transportation, and they offer health benefits, and they offer hearing, and they offer vision. Well, that's not necessarily true. That's called a Medicare Advantage plan, and the only example I can give people in this area that usually understand it is Kaiser. Anybody familiar with Kaiser? So Kaiser has a Medicare Advantage plan. So instead of having separate parts of Medicare, which is original Medicare, they sign up for what's called a Medicare Advantage plan. They get their A, their B, their D benefits all wrapped under one company, like Kaiser. But then Kaiser throws in a little bit extra stuff, right? Maybe some hearing benefit, maybe some vision, maybe some dental, maybe some transportation, maybe a food benefit, but you really have to find out what they offer before you sign up. And I only say this, we were talking about federal government, I have had people call me that get federal government retirement, which is the Cadillac of coverage, right? And they drop it to take one of these plans on TV. And once you drop federal, you cannot get it back. So you have to be really careful what you sign up for on Medicare, and that's why people call me, because they don't know what they're supposed to be doing. Some people fly through this really easily, but if you're older, it's confusing. I mean, try to explain to my mother who's 97 Medicare. There's no way she's going to understand it, so you really have to sit down with people like that, or anyone really that wants to do that. The other thing I talk a lot about is Medigap. Anybody heard of a Medigap plan? No, never? They're everywhere, too. Medigap goes with original Medicare. Remember I told you Part A and Part B cover inpatient and outpatient? There's costs associated with that. It's not free. So if you have costs associated with your Medicare, you buy a gap plan that fills in that cost for you. So you purchase a completely separate plan on top of your Medicare A and B that helps you pay the out-of-pocket costs when you use your A and your B. They're called gaps. You can either get original Medicare with a gap or a Medicare Advantage plan like Kaiser. You cannot have both systems. They're two entirely different systems in order to get Medicare. We personally, the counselors, like original Medicare best. It's managed by the federal government. There's no network. So if you have A, you go to the hospital that takes A. If you have B, you go to any doctor that takes B. You don't have to spend your whole time going, is it in network, is it out of network? Who do I go to? Do they cover this? Do they cover that? Very simple. And if you have issues with billing or your providers, you go directly to the federal government website or call the 1-800 number. The Advantage plans like Kaiser don't work that way. Federal government actually pays them to manage your care. It's a managed care organization. So if you have concerns or questions about their system, you call them directly. You don't go to federal government. So again, two entirely different ways to receive your Medicare benefits. And that's always the big question. Which one should I go with? Which one's more beneficial? Original Medicare is more expensive, but it's got better coverage. The Advantage plans are much cheaper up front out of pocket, but when you use them, you pay more when you use them. And I explain that to people when they call, because that's usually a pretty big question. The other thing we talk a lot about, may or may not pertain to anyone in here, and you may probably have not heard of this is called a dual eligible person. Someone asked me if I was going to do Medicaid. So dual eligible people have Medicare and Medicaid. So there are people, and I'll use my mom. She is 97, very low income, widowed as a young woman, never really made a lot because she'd never worked and had to raise her 6 children. So she has Medicare, but because it costs money and she's very low income, they allow her to have Medicaid as well. No, she's in Pennsylvania. So her Medicaid supplements her Medicare, right? Instead of getting that gap policy, she gets Medicaid. So people that have both Medicare and Medicaid, a lot of younger people have that too because they haven't had enough years of working to get Social Security to get a lot of money. So they may have Medicare primary because they have an illness, and then Medicaid second because their income is low. So Medicaid's typically based on your income. So they may have Medicare, Medicaid, call me up and say, I'm so confused. Who pays what? Who pays first? And then we try to show them different plans that take both Medicare and Medicaid, if that makes sense. That make sense? Sorta? Okay. Another thing we talk a lot about too, long-term care insurance. This is not private long-term care insurance. This is Medicaid. Medicaid is the only thing that pays for nursing home care outside of private pay. I am also the long-term care ombudsman, so I visit facilities to help people with their rights. The average, well, it's not even average, the cheapest long-term care facility in Prince William County now is $10,000 a month. $10,000 a month, that's what you pay to have your loved one go to a long-term care facility. Or Medicaid. So if someone calls me up and says, you know, we just can't take care of mom anymore, she has Medicare, but we really need a nursing facility, I know everyone makes, that's the hardest decision I think we have to make as human beings, in my opinion. And my mother is still not in a nursing home because we don't want to put her in a nursing home. We want her at home. You can get benefits in your home, but you have to apply for long-term care. And it's called long-term care for a reason, because you stay in that facility for long-term. You have to be very low income, and I mean very low income. You have to have very minimal assets, and you have to need long-term care in order to get it. So people may call me about that. How do I get my mom in a nursing home? Well, we don't want my mom to go to a nursing home. How do we keep her at home and get some help from the government or from these long-term care policies? So the long-term care policies that are in my brochure are generally Medicaid, not private. Because a lot of people have private long-term care policies, you know, how you buy them and then they pay for your long-term care if you're going to need it. The biggest negative about those, in my opinion, if you miss one premium, they're going to cancel you like that. And they go up all the time. They get really expensive. So you really have to decide, can I afford it? They're great, but it could potentially cost you a quarter of your income just to have long-term care. But generally speaking, I think they say, and I don't even like to say this, utter these words, I think 60% of the population at one time or another is going to need long-term care. The good news is Medicare pays for skilled care in a nursing home. So if you have to go to a long-term care facility for rehab, that's covered under Medicare. That's not long-term care, that's skilled care, okay? The other thing we talk a lot about, which I just told you, we are not, we don't sell insurance. I am not a licensed insurance person. I don't tell you what to do. I don't tell you where to go. I only reserve that for my family. But I can help you, sit down with you if you need to. Now, most of my appointments are telephone appointments because most people, once we get talking, they can understand and we go through the whole thing. But I do have people that are older, that are really confused, that may come into my office. But we only work in our offices one day a week. We're all working from home now. But that's something you could do if you have a family member or you're just totally confused about Medicare. Generally speaking, there's 3 times you can enroll in Medicare. Initial enrollment. So that's when you're going to be 65, right? I told you 65 and older. Your initial enrollment period is if you're definitely going to take Medicare, you're not going to be working, you have a 7-month window around your 65th birthday to get Medicare. 3 months prior to 65, the month you turn 65, and 3 months after. That's called initial. But that would be only for people that aren't going to continue to work. If you're going to continue to work like me, I don't even have to take Medicare. You can delay it till you're 90 if you want. I don't think my mom took Medicare. She took it pretty late because she worked really, really late in her life. So because I'm still working, I never even bothered to take Medicare. I can take it with a special enrollment period when I decide to leave my office work. And then I can sign up. There's no penalty, because you hear a lot of stories about penalties, right? My mom has a penalty. There's a 10% penalty. There is a penalty if you have a gap in coverage. Let's say I stop working at 65, but I don't take Medicare. And then 2 years later, you go, oh, I'm going to take Medicare. Well, you didn't take it for 2 years. You're going to have a penalty, all right? Part D is the same way. If you don't take Medicare D when you first become eligible, they're going to penalize you for that as well. It's not as much, but they're still going to penalize you. So you have to be really careful to know when you can sign up for Medicare. You don't want dates to slip. So you have initial, I told you about. You have special, which is when you retire or quit. And you also have a general enrollment period. This would be for somebody, I don't know even who this would be actually. Someone who didn't take it, they didn't know they should have taken it. Let's say they quit work in December or January, February. They don't even know about Medicare. Maybe their husbands are working. They don't think about it. Their wives are working. All of a sudden they realize they were supposed to take it. You have a general enrollment period every January through March that you can enroll in Medicare as well. So there are several times a year you can enroll in Medicare. You just have to be careful that you pick the right one so that you don't get that big penalty. And then it also impacts your insurance for your employer, right? Because you got to give them a heads up to let them know. So let me use me, for example. I could retire anytime I want. I'm older. I obviously can get Medicare. And I get to decide that every morning if I want to leave my office work. And I don't want to leave my office work because I still really like it. And what would I do all day? So I will, but if I decide to leave, I need to give Social Security. That's where you sign up for Medicare. It's not proactive. It is proactive. You don't automatically get Medicare. You have to proactively enroll in it. I would have to let Social Security know 3 months out that I'm retiring. It used to be a month, but now that Social Security is such a nightmare, as you've all heard, right? You've all heard the news. They're actually recommending you apply for Medicare 3 months shy of retiring. If you're going to take Medicare at 65, you can pretty much do it the month before because you're aging into Medicare as opposed to retiring into Medicare, if that makes any sense. So people are going to ask me, how do I get Medicare? When do I get Medicare? What forms do I need to get Medicare? What happens when I have Medicare? How much is it going to cost me? It costs different for different people. The base rate of Medicare B is $185 a month, but it depends on your income. And they charge you from your income 2 years prior to stopping your work. So if you made $200,000, 2 years later, they're going to charge you the premium based on your $200,000 a year you made, not on the $100,000 you're making in retirement. It's called an IRMA, but they will adjust that. Also, Medicare goes up every year. So everyone's supposed to get a 2.7% Social Security increase this year, right? Medicare is going up $15. So there goes your 2.7 increase, just so you know. Just so don't get all excited about that 2.7 increase. So that's pretty much what my job is, what I do for a living, what my work is. So the reason so let me give you one more tip. If you want my PowerPoint, and I have it, but it's long and it's pretty detailed and boring, that's one of the reasons I don't do them. I'd rather you just look at it. You can Google Prince William Agency on Aging. Tells you our services. One is health services. You click on that, and it says everything you want to know about Medicare, and it's my specific PowerPoint. Talks about when to get Medicare, how much Medicare is going to cost you, what it covers, because it works differently for everybody that's on it. It may be good for you because you're retired. It may be good for someone who's a state retiree. It may be good for somebody who's still working because you can take Part A. It may be good for someone who's disabled, who's still working. So everyone uses it differently. So it's a very broad program, and it's just different for everybody. So that's why I don't get into the minutia in here. And I always tell everybody, if you have a specific question that pertains to your situation, just give me a call. I'm really good about returning calls really quickly, even though I do this job part-time. I'm happy to set up an appointment. If you want to come in, it would have to be a Friday because that's the only day I'm in the office. And I'm happy to answer any questions for you. So I don't think that was 35 minutes. No?
No, that was like,
See? I never know. Okay, well, so now I'm going to ask you guys if you have any questions for me. And I know this is very brief, but this is what I do, and it just makes more sense instead of a long, boring PowerPoint. Yeah, go ahead. 703. Yep.
So we'll take questions one at a time,
Okay,
one from the sister
792.
side, one from the brother side.
4156. Yes,
Okay,
please.
if you have it.
Get it?
Okay.
792 4156. That's my direct line. Rosemary. That's okay. Rosemari. Yeah, you should call me. Yeah. No, you call me anytime you want. I'll call you right back. Yeah. Well, except after. Don't call me at home. Don't call me at night. Yes. No, 4156. You're welcome. Go ahead.
So there is no time limit when you can retire, when you are retiring any day
That's
of?
up to when you want to retire, yeah.
So there's 3 months gap period after you can take Medicare?
Right, right. As long as you're covered by a large group health plan, I assume you are, 20 or more people is considered a large group health plan. You can stay on large group health plan forever if you want. They tell you, they encourage you to take Part A because Part A is free. Part A would be secondary to your large group health plan. So let's say you went in, Part A covers hospital, right? So let's say you went into the hospital with a surgery under your employee, and then there's a balance, then they're going to bill Part A for the balance. But a lot of people don't take. I didn't take A when I was 65. I just decided, the heck with it, I'll take it whenever I retire. I'll take both A and B then.
So it means there's no penalty if you
No, it's only
go
penalty-
within 90
No.
days?
Part A has no penalty ever.
Okay,
Part B only has a penalty, again, if you don't take it when you retire, right? And there's a giant big gap. Let's say you retire in 2026 and you don't take Medicare, and then you wait till 2027, you're going to have a penalty. As long as you do it within a time period, and after you leave your employer of 20 or more people, you actually have 8 months to get Medicare B
okay.
without a penalty. And the penalty is 10% for every 12 months you didn't take it that you could have, right? Which is a lot. It's 10% of the price of the premium at the time you purchase it. So, and it's for the rest of your life. It's not a one-time. Sorry. It's not a one-time penalty. It's the rest of your life. So it's important that you take Medicare when you should or when you can.
Thank you.
Sure.
Madam, if the person is not a citizen and he is a resident for about 3 years, let's say, so will he get the Medicare?
No, you have to be a resident of the United States for 5 years. You can have a green card, citizen over 65, but you have to have been here 5 years. Otherwise, you can get it, but the key is they're going to make you pay for it, you see? So Medicare A is free for everybody because you've worked 40 quarters. But if you haven't, they're going to charge you, and A is almost $550 a month. Part B is $185. You're going to be charged that regardless. But yeah, in order for you to get it for free, you have to be here 5 years.
5 years.
Yeah. Yeah. Uh-huh. Well, no, you need to call me. Give me a call. Just call me.
Please use the mic.
Yeah. Yeah, just call me. And you don't need, most people don't need an appointment. The minute they call me, we start talking, because they think they need an appointment, they'll say, oh, I just wanted to know how to get B. We're not doing an appointment just to figure out how to get B. Appointments are really for people that are really, really struggling with every process. If I can tell them everything they need to know, plus we all have computers now, and I can tell them where to look, usually they don't do appointments. I can't tell you the last time I had an appointment. So again, I'm not opposed to it. I just, like, by the time we talk, you may not even need one. Anybody else?
Yeah, hello.
Yeah, hi.
It's a question regarding Part A,
Yeah.
which covers 80/20, I think it is, right?
No, Part A isn't, there's no 80/20. Part B is 80/20. Medicare Part A covers everything in the hospital except $1,600 and I think $67 deductible, Part A.
Okay, so it's not 80/20 then?
No, that's
Oh,
Part
okay,
B.
I thought I heard something.
Part B is 80/20. If you
So
use B services.
what is the difference between the Advantage and Medigap? Can you have
Yep.
one or the other, or
No.
you can have both?
You can't have both. You can either, they're two different systems. So original Medicare goes with a Medigap, right? You have A and you have B. Then you have copays, right? So you may not want to pay a copay. Sorry. So what you do is you purchase a gap policy that pays the copays for you. So let me give you an example. You have Part A. Basically, there's a deductible for Part A, which is $1,600, right, if you use your A benefit. If you don't have a gap policy, you're going to have to pay out of pocket for that, right? If you go to a nursing facility, Medicare pays 100% for 20 days, but your benefit lasts 100 days. So let's say you have a skilled care need. You break a hip, you have hip surgery, knee surgery, whatever. You end up in the hospital 3 nights. They send you to a nursing home, skilled care, because you need therapy. Medicare is free for 20 days, but you're out of pocket using your A benefit, because A benefits cover that skilled care. It's $200 a day for 80 days, right? If you purchase a gap policy, that gap policy pays that for you. When you use your B benefit, Medicare pays 80%, you pay 20% for all B services. So doctor visits, labs, x-rays, durable medical equipment, chemotherapy treatments, colonoscopies. Medicare is going to be billed 80, you're going to be billed 20, but that gap policy pays that for you. Now, they're not cheap. They can be $100 to $300 a month. So that's in addition to your B premium, right? Now you have another $100 premium for gap policy. They don't cover any drugs. They don't cover vision. They cover no dental. So you're talking about multiple plans to get really good benefits, but expensive. The flip side, that's original Medicare. That's federal government. No networks. They travel. You can travel across the United States. You use your Medicare. You use your gap policy. Flip side of that is the Advantage plan. And when I usually do my presentations, I always say Advantage with air quotes. The only advantage to an Advantage plan is those extra benefits, right? You have some vision, some dental, and they include drug coverage, like Kaiser. Remember I used Kaiser as an example? They sometimes have zero premium, so they're cheaper up front. But they don't cover the $1,600 deductible. They don't cover the $200 skilled care. They don't cover the 20%. They may cover part of the 20%, so you pay a lot more out of pocket when you use those. And they're networks, and a lot of people don't like that. They don't want to be able to go, are you in network, you out of network? I've had too many people call me and say, and you know, pretty common stuff. I really want to go to my an oncologist in Springfield, for example. My daughter recommended it. Well, they can't use it because the doctor doesn't take it because it's out of network. So people don't like that. They like original Medicare because you can go to any doctor that takes Medicare. There's no network. So it's either one system or the Advantage plan system. Can't have both. And it's hard to switch between them. That gets complicated too. Let's say you have an Advantage plan like a Kaiser, and all of a sudden you don't like it. You cannot go backwards to a gap policy, depending on situation. It's a long story, but that's why people call me. But you can go from one Advantage plan to a new Advantage plan if you want every year. So if you don't like Kaiser, for example, you can go to an Aetna Advantage plan. You can go to an Erie Advantage plan. You can go to Blue Cross Blue Shield Advantage plan. But they're all similar in that they include vision, dental, and drug coverage under one roof with one premium. So it just makes people's lives a little easier, but you're definitely going to pay more out of pocket if you get one of those. Does that make sense?
Yeah. And one more thing, that does Kaiser provide you with the Medigap insurance also as well?
No. No, Kaiser's all inclusive programs. Whether you're retired, I think federal has a Kaiser plan, Medicare has a Kaiser plan, but that's all inclusive.
Thank you.
And some people don't like that too because they don't cover everything, right? There's a lot of pre-authorization type stuff in these Advantage plans, and people don't like that either. You don't have any pre-authorization or deductibles when you use regular Medicare with a gap. The negative is they're more expensive, and if you can't afford that, if somebody calls me up and they're only making $2,000 a month, I'm not going to, of course, I'm not allowed to recommend anything, but I may sway them, I guess, one way or another because they can't afford $185 for B, plus another $150 for gap, plus a drug premium, plus vision, plus dental, right? They just can't afford it. That could take a third of their income. So that might be a person that might be better off with a Kaiser because there's no premium. And they're still going to get some drug coverage, and they might get a little extra vision and dental, right? So it just depends on what you're looking for.
I got a question, if
Yeah.
you're ready. Okay. So if the husband, for someone,
Yeah.
is old and wants to retire, I mean, because he's on the retirement age, and the wife is not on the retirement age, but decide to retire without the retirement, the pension plan or anything like that, how do they get the health insurance, the wife?
Obamacare.
Obamacare?
Or Virginia Marketplace.
Okay. So it's not,
But there are plans like federal government. Federal government offers they offer retirement plans for both.
okay.
So the husband who's 65, let's say, he has Medicare first, his federal retirement second. He can keep his wife on his federal retirement plan until she's 65 if they want to. But
Okay.
a lot of people don't have federal retiree. They have nothing. Once the spouse leaves, either one who's ever getting the insurance, right, is that what you're asking? And the other one's younger, maybe they're only 63. They're 2 years shy of Medicare. The only option out there is private health care.
Okay, but the wife is eligible to, hook up with the plan the husbands get, the Medicare plan. Is that an option?
No.
Any option? No?
Medicare is strictly individual.
Individual,
It's only for
okay.
people over 65 or under 65. If she's disabled,
Uh-huh.
if the wife is disabled under 65 and has, Medicare, she could get Medicare. But if she's just not disabled, but she's been on his insurance, and then he decides to retire, and she's still too young for Medicare, no, she doesn't have an option other than private health care.
Just a private health care? Okay. And you don't, I mean, you cannot recommend any of them,
I just
right?
tell people to go on the website,
Okay, all
Virginia
right.
Marketplace.
Okay, cool.
And they
Thanks.
range, you know,
Right.
from price, that
Yeah.
depends on your income and all that kind
Yeah.
of stuff. Yep,
Okay, thank you.
sure.
Is any sister has any questions here? No?
Oh,
We have a question right here.
okey-doke.
I have a question right here. I know you can't recommend anything, but if you have a family member who is on dialysis, what do you recommend in this? Advantage or Medicare A or B?
Well, the dialysis. Oh, I told you, I'm so used to talking so loud that I never need these. I'm going to do this. Yes, if you have are they 65?
Yes.
In my opinion, I'd go with a GAP because GAP's going to pick up the 20% you have to pay for every dialysis treatment. An Advantage plan's not. An Advantage plan probably isn't going to even pay 20%. So you're going to be stuck with 20% bill for every dialysis treatment. So if it were me, I would probably go with a GAP policy.
So do you apply for Medicare first and you apply for the GAP
Yes, you
later?
can't have a GAP policy unless you have Medicare A and B.
Okay.
You also can't have an Advantage plan unless you have A and Bs. And you also have to be old enough to get A and B.
Okay.
But if you're younger, let's say you're 64, 63, 60, and you have renal failure, you can get Medicare almost instantly because you have a special circumstance. Lou Gehrig's disease and renal disease are two things where they'll give you Medicare almost immediately. You don't have to wait for the 2-year period and prove that you're disabled. Because with Lou Gehrig, you're probably not going to live 2 years, right? So there's certain circumstances where they will give you Medicare pretty quickly. And disability is a check, like retirement. So I'm on Social Security, right? My full retirement right now. So I get a retirement check every month. If you're disabled, what you're applying for is a disability check. So you have money to live on. And once you have that disability check, you qualify for Medicare after 2 years.
And dialysis qualify for disability?
Pardon me?
Dialysis, is it qualify for disability?
No, well, yeah, if you need dialysis and you have renal failure, yes, but not if you're over 65. Disability is only for people under 65. And once you're 65 or older, you're just old enough to get Medicare, dialysis or no dialysis. Does that
Thank
make
you.
sense? Yeah, you're welcome. Yeah. I don't even know what, you could go to the free clinics. I think you have to be a citizen in order to even get Obamacare, but I'm not 100% sure. Marketplace, but go on Marketplace. See if that too. Also, you're not a citizen, you have a green card, yes? You have a green card? Okay, how long have you been here? Okay, so what you can do is, hold on, I gotta think for a sec. Oh, you can get Medicare, but you'd have to pay for it, right? So like I said, it's pretty expensive. If you're considered low income and you apply for Medicaid, Medicaid will pay for it. Yes, but see, so you're between a rock and a hard place. I bet you make too much money to get the help to pay for it, but you can't afford to pay for it, right? See? So free clinic, talk to your doctors, samples. If you go to the emergency room, they have to treat you. They can't deny you. Okay, so just for that. The free clinic takes anybody with or without insurance. And I think there's one in Woodbridge. I thought there was one in Manassas, but I don't know where that is now. But Google it. I Google everything. I'm Googling all YouTube when I leave here. Anybody else have a question?
Yeah, please.
Yes.
So one has to have 40 work credits, 40 quarter credits before one
Yeah,
is
40
eligible
quarters or
for.
10 years, yeah.
Yeah. So suppose few credits are short of 40, 35, 38, something like that, and one has worked outside the USA and has submitted the tax returns based on world income. How to get the credits for those years in this?
They don't count anything outside the United States.
They won't count.
No. Unless you're in the military and you're stationed somewhere crazy, but that's still a U.S. That would be a job. No, it's here when you're paying Medicare taxes, Social Security taxes. So if you have 35 quarters, you could still get it, and you wouldn't have to pay as much as 500, right? It's like prorated, so you'd pay a little bit less than you would for somebody that has no quarters.
Okay.
Until you can get those quarters.
Okay.
Yeah.
Thank you.
So my question is, if a person is 65 getting Medicare, and a person is disabled at the same time. Can they get both?
No.
Or just one?
Just one.
Just one,
So
okay.
65 or under disabled, the minute you turn 65, it's just a regular a check, just a regular.
No more disability,
No,
okay.
it's not
All right.
considered disability. It's the same pot of money,
Okay,
so, yeah.
all right, thanks.
Yeah.
Disability factors, what makes somebody disabled?
Well, I don't work for Social Security, so I wouldn't be able to tell you specifically. You just have to apply through Social Security. But like I said, if you have Lou Gehrig's disease, renal failure, those are the big ones that they're going to give you disability probably right away. But I've had people, unfortunately, that are so overweight they can't work. I've had people have mental health issues, they can't work, or they can work part-time, because you can work part-time and still get disability. They just they don't allow you, well, maybe you can't work full-time, right? So you can work part-time. But that would be a Social Security question. You apply for disability through Social Security, and they're the ones who make that determination. Okay? Anybody else?
Is the Part B is covered the medication as well?
No, Part D.
Part C?
D. Oh, C? So yeah, so Part D covers medications, right? It's called drug coverage.
Same that 2018?
No, it has no, there's no routine, there's nothing 20, no. So Medicare D covers prescription drugs only, but if you have a C plan, which is the Advantage plan, that includes drug coverage. Okay, so you can get your drugs through the C plan, Medicare Advantage, like a Kaiser, or you can opt for original Medicare with a standalone drug plan, right? There's only 12 drug plans this year. When I started, there were 57 different drug plans in Prince William County alone, and talk about confusing. So now there's only 12. They're pretty, you can get one real cheap. My sister, who's 76, she takes 6 medications. She has a 0 premium plan, and she pays nothing for any one of her drugs, 0, because they're all generic, and they're pretty much what we all take, right? When you hit 65, they put you on Lipitor and blah, blah, blah. My sister, who's 71, just turned 70 last week, this was last year, she was paying $900 a month for one drug. So everybody that's on D is different. It depends on your drugs and your pharmacy choice. Now with the Inflation Reduction Act that the last administration put into law this year, even if you have $50,000 worth of medication, you won't pay more than $2,000 for the whole year. They've gotten all the drugs reduced to $2,000. One more thing that has changed, this is only for GAP. When you purchased a GAP policy in the past, you had to stick with it regardless. So let's say you were on a GAP policy and you were paying $200, right? And it started getting, because they get pretty expensive. And then you're like, you know what, I just saw a GAP policy, because everyone sells them, and it's only $100. You're not allowed to go back. You never had guaranteed issue again. Guaranteed issue is when they have to sell you the policy regardless of your health. They cannot ask health questions. And that only happens once when you first become eligible for Medicare. So people are staying in them. Let's say you had a Blue Cross Blue Shield GAP policy, and they get more and more expensive. I think my mom pays $400 or $500 a month just for her GAP. But she's been on it for 30 years, right? She's had $70,000 procedures. She's paid nothing out of pocket, right? She would be really poor. They have a new law that just passed July 1st, and it is where you can, on your birthday, let's say you have a GAP policy, you're 65, you have A and B, you chose to get a GAP. Every year on your birthday, you can pick another GAP policy if you want. So it has to be the same benefits or less. So G policy is really the one most of us get at our age, my age, 65, 67, up to 70. The G is the best policy. Let's say I find one for $100. Next year it's around my birthday and I find one for $75. If it's the same policy, same benefits, I can jump ship if I want. And they never allowed that before. And they have to guaranteed issue. They have to sell it to you without asking about your health. So that's a new thing that went in just July 1st. All right?
Part B is outpatient, right?
Yes, Part B is anything you do in a doctor's office, even if you have injections, blood transfusions, chemotherapy treatments, how you know they have to put the port in, that's all considered outpatient. Go ahead.
Question over here.
Whoops, sorry, you better put your hand up. You're getting it.
Please raise your hand if you have a question.
Go ahead.
Yeah, if you work in a part-time, you still can have Medicare?
Oh, yeah, you can have Medicare and work full-time.
full-time,
I don't advise you, don't do it full-time. Because remember, use me. I work full-time. I don't need my Medicare because I work full-time and I get my benefits from my company. I could get them, but then I'd be paying Medicare premiums and my group health insurance, right? You don't need to do that.
If you don't take your help from the.
Right, so I'll give you another example. My brother, who's 71, anyway, I guess it doesn't matter how old they are. Let's just say they're all old, okay? We'll just put it out there for him. He was working, had full coverage, and then COVID hit. And of course, he decided, they laid him off and they dropped his benefits. He was, wasn't really wanting to stop working, but it just so happened. So when COVID sort of started to wane, they called him back. And guess what? They offered him his health benefits again. So then he had to decide. He went ahead and took Medicare because he needed something. Do I keep Medicare or do I jump ship and go with my health insurance for my company? It's too confusing to try to switch back and forth, and it can mess you up. And he didn't want to have to mess with that, so he just stuck with Medicare and then said he didn't want his health benefits through his company. You can do that too. It's no different than when, like, my husband's on my insurance. He's on mine instead of me being on his, or both having our own. You know what I mean? So yeah, you can just keep part-time, full-time. If you're part-time, you want Medicare, great. If you don't, but don't take Medicare if you're full-time covered under a large group health plan, 20 or more. If it's a small group health plan, 20 or under, that group health plan is probably going to make you take Medicare because they don't want to be the primary coverage, right? Make sense? Some people get mad about that. My former brother-in-law, he was really mad because at 65, his company said you have to take Medicare. There was less than 20 people in his company, and that really bothered him. He's like, why are you forcing me? I said, well, they're not forcing you. That's the federal government's thing. Because your plan doesn't want to be primary. That's expensive. If you can get Medicare, right, they want to be secondary. It's cheaper for them. Does that make sense? Right. Anybody, you had a question. See? He's next.
My question is, my wife is covered by the federal thing, and now I'm going to 65. Yeah. So I have a health insurance coverage with her. So is that will prevent me from applying to Medicare?
Okay, so let me repeat, I think, what you said. Your wife has a federal active employee plan, and you're on it. She's retiring. She's going to stay on it. Yes. So you can stay on hers as long as it's active. When she retires, you should take A, remember, because are you going to be 65? Okay. Take A because A is premium free. A is going to be primary to her retirement hospital. So A will be billed first if she ends up in the hospital or you do. Federal will be second. The biggest question federal people have to make is, do they take B? Because, it gets a little weird, B is going to be $200 a month. So at the end of probably next year, it's $2,400. And all it does, it's primary and then your federal secondary. If you guys can afford your co-pays to your federal retirement plan using doctors, outpatient services, right? How much do you pay for outpatient services when you go to the doctor? You have any idea? Okay. So do you pay a copay or anything?
Yes.
Okay. So what happens is you have to weigh the pros and cons. Is it worth spending $2,400 a month? If you can afford the copays, why would you know what I mean? That's the biggest thing you have to. But there's two caveats to that. As long as you understand that when you decide, if you decide to jump onto B down the road, you have that penalty, remember? Because you're not actively working. And I'll do worst case scenario. You end up with cancer in April, and you're spending a ton of money at Kaiser, co-pays, co-insurances, the courts, everything that cancer involves, right? And then you say, you know what, we should have taken B, because B would be primary. You can't even get B then till the next January for general enrollment. So you guys have to decide what works for you. As long as you understand that every year during general enrollment, you could jump on to be Medicare if you want. But you get your drugs through Kaiser, right? Your doctors, your labs, your x-rays, vision, and dental. So we're hard-pressed to tell people that have retirement federal to get B. You just have to really weigh the pros and cons. Some couples, one person will get B if they're not healthy, and the other person won't. But your Kaiser plan under federal, I don't believe requires that you get B, but call them first. Because it's a funky thing, they may, like my brother-in-law, they may say, hey, we don't want to be primary, you have to get B, but I don't think they do. Right. I mean, so again, supplementals, gap policies, supplementals, and secondary is all the same thing. Kaiser's not a supplemental plan. Kaiser's her retirement plan. That's different. Kaiser retirement plan is different than Kaiser Medicare plan, if that makes sense. They're just different things, because one's retirement through your company, you pay the premiums to your company, you've worked there all your life, that's a benefit. Let's say I took Kaiser when I retired, it has nothing to do with my retirement plan. I don't have a retirement plan, so it is totally different. All right, does that make sense? Thank you. Anybody else?
There's a question here.
Go ahead.
Yeah, I'm back again. Question about the time. How long does it take for them to process your application? Because I applied in mid-July. I still haven't heard anything from
Well,
them.
that's what I was saying before. So when I had my conference, and it typically was, are you over 65 or just turning 65?
I'll be 65 this October.
Okay, so typically if it's aging into Medicare, it's a process is much quicker, right? So if you applied in July, you should be hearing pretty soon. It's only mid-August, okay? If you're retiring into Medicare, and I'll use me again, if I decide to retire next week or at the end of the year, I would have to give them almost 3 to 4 months notice because I'm retiring into Medicare, not aging. So you should be getting your notice pretty soon. But check your account. It should be on there. And did you go online or did you go in the office?
Online.
And was it pretty smooth sailing? Were you
Yeah.
able to get through? Okay.
Yeah.
Just wait for them to, you can wait for the card. It'll have A and B on it effective in October. Or you should sometimes get a confirmation letter. But you can check your account and you should be able to, they should be able to tell you whether you're on it or not.
Well, I did check my account. I guess it's got like 1, 2, 3 process. First one is clear, second is clear, third one just not going anywhere.
Not yet.
So,
Well, don't panic too much. You have, we're mid-August, you have all of September. You should apply for your secondary insurance and stuff when you get, you can't really get anything until you're going to be eligible. I would recommend maybe the beginning of September, just give them a call at Social Security office and ask them what's going on. I know that's a nightmare too, because I've heard you have to wait for hours because they haven't processed your application yet.
okay. One last question about the Medigap.
Yeah.
I think there's a certain time limit for you to sign up, otherwise you go through scrutiny and they
Yes.
can even deny you.
Underwriting. Guaranteed issue is 6 months from the time your B is effective. So your B is going to be effective in October. You have 6 months to get a gap policy, and they cannot ask you about your health conditions. It's called underwriting. They have to sell you the policy by law. After that, which my brother did, by the way, they don't have to sell it to you, and they can ask about your health conditions, and they can say, well, you're too high risk, we're not going to sell you one. So that 6 months is important. But if you want to save, if you find a policy for $100 a month and you want to save $600, you could wait. I tell everyone, get all your tests done and all your labs and x-rays when you're working, and that way you can have that 6-month reprieve from getting a gap. But just make sure you sign up for the gap in that period. Definitely no later than your 6 months. Okay?
We have a question here.
Yeah.
Yeah, hi.
Hi.
Thank you. Yeah, just a quick question. Would internationally too, when you are on vacation or
I'm sorry.
business trip, if you're out of country, it will apply? All
No,
these
Medicare
plans?
doesn't apply if you're out of country. Although some of the gap policies they have a limited coverage. Like the G policy, I think there's like a $50,000 for out of the country. If you're 1 foot in Mexico or 1 foot in Canada, that might be the only way. If you go on a cruise, we always tell people to get travel insurance because Medicare won't cover you.
Travel insurance.
Yeah.
Okay, thank you.
Sure. Yeah.
So what is a good time to apply for Medicare A plan if someone didn't reach to 65 but will be soon? I'm asking about someone.
Initial enrollment period is 3 months prior to 65th birthday,
Okay.
the month you turn 65, or 3 months after.
Okay, Medicare A.
Yeah.
And what require for the
To
eligibility?
apply,
You wanna
nothing, just to be
apply?
65.
Just be 65
Yeah.
and that's it? And you don't
Right.
have to pay for the plan or anything like
No,
that?
Medicare A is free, doesn't cost you anything to have it unless you aren't a citizen or unless you haven't been in this country for more than 5 years, and if you've worked 40 quarters, you're good. So the initial enrollment period is 3 months prior, the month you turn 65, 3 months after. A is free, and you go through Social Security office to get it. But not everyone does that. You don't have to apply for A, there's no penalty if you don't take it, but it's secondary to your active group health insurance.
Okay.
So if you have surgery and you use your active group health insurance as billed first, if there's a balance, they're going to send it to A. So for a lot of people, they take it just because they figure, hey, I paid all my life, I paid into the system, I've worked, I'm going to go ahead and take it. I didn't take A because I'm lazy, and I just didn't feel like going through the process.
I'm sorry, what is active group?
Active, if you're actively working.
Oh,
as opposed to
actively,
retired. Yeah,
working,
Yep.
okay. Okay, and the A covers doctors
No,
and...
A is inpatient, hospital only.
Oh, just hospital
Yeah,
only.
admitted only, not emergency room either.
Okay.
You have to be
okay.
admitted for A to be the coverage.
Very tricky.
Yeah.
Thank you.
Yeah, sure.
We have a question here.
I have a question about disability. Do you have to, is there a set limit for the age and
Under 65.
any,
Yeah.
okay.
Yeah.
And you have to be US citizen?
I think so, but again, I'm not a Social Security person, disability, but I'm going to say probably.
And last question, is there, you have to meet the 40 quarters criteria for that?
No, not for well, for disability, yes, you still have to make 40 quarters because they're going to make you pay for your Medicare. You see what I mean? It's going to
see.
cost you, yeah.
Okay, thank you.
Yeah.
Thank you.
Anyone else has any questions?
Oh, I'm good, thanks. No. I just carry my, it's not alcohol either, it's just iced tea, in case you're wondering.
If there are no questions, Rosemary, thank you very much.
Thank you for having
for
me.
coming. We appreciate it. And everyone, if you find this workshop to be beneficial, if there are other needs in the community of such nature, please relay that to us so we can coordinate those for you.
Oh, you know
There's one more question over here.
Mr. Rosemary, can you talk a little bit about the 40 quarters
Quarters, yeah.
thing?
10 years. You have to work 10 years or 40 quarters in order to get Medicare for free, Part A, in order to be eligible for at no cost.
Thank you.
Let me say one more thing. Yeah, the Agency on Aging also does more of a thorough presentation that's for aging services in general, right? Not just specific to Medicare. So we have a couple outreach people that can come. They talk about Meals on Wheels, the adult daycare, and all the services Agency on Aging offers. Not even maybe for you guys because you're too young and healthy, but if you're caring for parents, there's a home care program, there's Meals on Wheels. So somebody from our agency can also be called and they can come do a presentation as well. No, it's a request. If you request it, they can come, yeah. Go ahead, you're welcome. Is she actively working? Does she work?
Yeah, she works.
And is it a large group health plan?
No, she has insurance with
Her company.
company.
But is the company's, is it 20 or more people in her company? Is it a large?
Yes, this is government job.
Yeah, okay, and so they put you on A and B by accident? Because you
They
turned
sent it
60?
to me. I did not reply.
Oh, yeah, you need to, yeah.
They sent it to me.
I would not take that. If you're on her insurance and she has 20 or more people and your doctors and, all the stuff that's covered under group health insurance like me, just contact Social Security and tell them you don't want B because they'll charge you $185 every month and you don't need it.
Who are you calling?
Social Security.
Want me to call you?
No, I'm not Social Security. SSA.gov. SocialSecurityAdministration.gov. Okay? Or you can call them, you Google their number, and you can call them and tell them you don't want it. They may make you fill out a form because they want you to understand the ramifications of not having B.
I did not reply.
I know.
They sent it to me.
Are you on disability by any chance?
No.
Nobody.
I'm now 65. I just got it.
Wow, lucky you. Well, are you drawing Social Security? No. Because typically if you're drawing Social Security, they will automatically enroll you in A and B. But if you're not, I know that's what I mean. So definitely call them back because you don't want to be paying both. Tell them you don't need it. They may make you fill out a form so you understand.
SSI.com.
Yes, SSA.gov, SocialSecurityAdministration.gov. Yes, okay? You're welcome. Don't be letting them charge you more than you have to. No.
So, website for applying for
Medicare, SSA.gov. Social Security, yep, that's where you apply for Medicare. Yep.
And the gap is going to be also there?
The what is?
The gap?
No. The gap will be something you look into after you're officially enrolled in A and B. You can call me and I can walk you through that as well. Okay? No, Social Security. Social Security is where you enroll in Medicare. SSA.gov. SSA, Social Security Administration.gov. Yeah. Yes, they will enroll. That's where you go to enroll in A and B. Yep. Oh, well, it's $185 for B. By the A's free. It doesn't cost you anything. Let me think. So A should be free, although it may not be because you didn't work your 40 quarters. So you'll find out what it's going to cost you. But are you 65? You said yes. Older than 65. I don't know what they're going to,
I'm about 70.
Yeah. I got it. I'm just trying to think if they're going to charge you because you don't have any quarters. They're probably going to charge you for Medicare.
But 5 years.
Okay, so let me back up. In order to get it, you have to be here 5 years. But they're going to charge you a amount because you haven't worked this into the system. You haven't worked your 40 quarters. But I don't know what that charge will be at that time. Does that make sense? Okay. See, I keep asking if I make sense.
I want more information. I read this last month, and I'm still working.
Okay.
I'm making less hours.
Okay.
But I want more information. So you as a website to go through to go with this program more and more.
No. Are you full-time, part-time employee?
I'm still full-time by cutting down my instead of
Are
5 days.
you getting insurance? Active health,
no.
group health, no active. So you definitely want Medicare.
Yeah.
Okay. Do you have any retirement insurance? Do they cover you in retirement or no?
No.
Okay. So what you need to do, when is this effective? So this was effective for almost a full year then, going on 2 years.
No.
12, well, okay, 1 year, sorry, I'm losing it. So you need a gap policy to help to go along with this. When did your insurance for your company stop? When is your group health insurance ending? Did it end already, or when did it end? When's it going to? When? Because see, you only have 6 months to get a gap policy after you turn Medicare. So you're out of your 6 months. You can try to get a gap, but they may not sell you one because you're out of that 6 month. In order, if you get an Advantage plan, you can go to Medicare.gov to look at Advantage plans this open enrollment, which is October through December. And you can apply for one of those plans like Kaiser if you want, okay? And they'll cover vision, dental, drugs, and your A and your B benefits. But you can't do that till the open enrollment because you're out of any special enrollment period. Does that make sense?
I use more benefits. I'm getting Social Security.
Right. But you still have A and B. You still need something to help you with A and B. You need D. You need a drug plan. You need potentially a Medicare Advantage plan because they have some vision and some dental coverage. You see what I mean? But you can't do anything until open enrollment, October 15th through December 7th at Medicare.gov.
And then go.
Yes, you'll see all the benefits.
And this program,
That's
is there any
me.
website?
No, it's just me. Yeah. It's just what my program is. There's not really a website. You can call me if you want to. Yeah.
But thanks for your help.
You're welcome. Yeah.
Is there any card, such kind of card for the emergency Medicaid?
Emergency Medicaid? No, just call Medicaid. Yeah, I can give you the number. You want the number for Medicaid? Are you going to remember it, or are you going to write it down? I know you're smart, but come on now. I don't have a pen. Hold on, I might have a pen. So Medicaid is 703 792 7500. So that's a good question. Let's say you go in the hospital and you get $50,000 worth of bills and you can't afford them. They offer what's called a spend down at Medicaid, where they might pay your bills because they know you can't possibly afford that. But that'll depend on your income and everything and your assets and all that.
Suppose I'm not on the job, so.
Right. But you still have money coming in, or you still have assets. That's what they're looking at. Trust me, they're looking at everything. Nothing's free anymore. Go ahead.
If I want to apply for a Medicare, what should be the eligibility?
Disability? For Medicare? So you're 65.
Yeah, we applied 4 months ago. We didn't get any response.
Well, you have to go through Social Security. Did you go through Social Security?
Social Security?
Social Security is where you apply for Medicare A and B. And you have SSA.gov.
I should go through Social Security.
You can either go there, but it's a nightmare from what I've heard. You can call them and make an appointment for down the road, a phone appointment, to apply for Medicare. You have to be, yes, Medicare. Medicaid is the number I gave him, 703 792. Get your phone out, sure.
Yeah, I applied for Medicare, but
Medicare or Medicaid?
Medicare.
Okay.
I did not get any response.
Then you need to call them and ask to talk to their eligibility worker because they have access to your records. And say what happened. You should have gotten a letter saying no or yay or nay. Okay, that's what I mean. Right. So you have to call them.
So, for the last 7 months, I'm not working anymore. I have got RT credit, so still I did not eligible for that. Get a Medicare or Medicaid.
Medicare is for 65 or older.
Yeah.
Okay. If you haven't worked 40 quarters, you have to pay for it. But Medicaid will help you pay for it depending on your income and your assets. But you have to.
I have no
Okay, that's okay. Don't tell me. You're going to tell them. Medicaid, when you apply. Okay.
You know, when I do not have any income, in that case, is a possibility of getting me Medicare?
Sure, Medicaid will pay your Medicare if you have no income and your assets are low. But you have to apply for it. You have to fill out a big, long application. You can apply for Medicare first, and you're just knowing you're going to get a bill. They're going to start, you got to pay for it. Then you apply for Medicaid, and Medicaid says, oh, he doesn't have to pay for that, his income is zero.
Is that better? I should go to the office or I should go online?
I can't, Medicare, no, I'd say you make an appointment for them. Call them, make a phone appointment, because I've heard, and I'm only telling this because this is what people are telling me, they're waiting hours and they're not even being seen. Medicaid, you can go to their office too, but I don't think there's anybody there. So, but you can call them and you can apply right over the phone with Medicaid, okay? If you have a pencil, paper, I'll give you the Medicaid number. Here, put on your phone. Okay, ready?
Yeah.
So Medicaid is 703 792 7500, and that's Medicaid. And you can apply right over the telephone. Medicaid, Medicare, Medicare is 65. That number is it's ssa.gov. I thought you said you have Medicare already.
Well, I don't have any one of them. I have
Okay, and you're 65. How old are you?
Yeah, I'm about 65. I have taken
You're about 65, or you are 65?
about 65.
What does that mean? I'm about 25 too, but about 50 years ago.
I over 65.
When will you be 65?
I'm already 65.
Okay, good. Oh, no, I'm fine, please. The longer I stay, the more, yeah, no, I'm good. The more likely my husband is to start dinner if I wait. No, you're fine, no. So Medicare for 65 is SSA.
It's okay. I want the phone number. I call them.
I don't have the number. You have a computer? You have to Google. This is Medicaid. Two different numbers, two different agencies.
You say number or
The phone number for The phone number for Medicare, you have to Google. Because it's an 800 number, they're going to send you to the main office. So just type in Social Security.
I will get there.
Okay. So that's where you apply for Medicare. This is where you apply for Medicaid.
In case of Medicare,
Uh-huh. Yes.
if I'm taking only applying for A,
Uh-huh.
so what is the monthly payment I have to
Zero. If you're a citizen and you've been here forever and all that good stuff, yeah. There's no charge for A if you've worked 40 quarters.
I am eligible to go for a doctor and get
No. Part A is hospital only.
only hospital?
Yes.
If I take it B, then I had to pay for
Yes, B is 185 a month. Yes, but if you have Medicaid, it can help you pay that B premium if you're low income and low assets. Yes, so first Medicare, and then you apply here so that they pay for it.
Rosemary, do you need to go?
No, I'm good. Until the longer I wait, my husband will start dinner faster. See the trick I do? I'll be like, I don't know. Good. How come you can ask questions out there to
Just I want your recommendation. I'm on the right direction. I'm 68 years old. And recently I did my last day was August 1st.
Okay.
And my insurance will expire 31st of August.
Okay. Is it federal? What insurance did you have? Do you have any retirement, or is it completely done now that you're not working?
They laid me off.
Okay, got
I
it.
got a Part A 3 years ago.
Okay, gotcha. See, okay, yep.
And now I applied
But for B. Uh-huh, yep.
I send all the
Yep,
documents.
yep.
They said give the proof of
Yep,
the
proof of employment.
You are insured
Yeah,
and now
yeah.
my wife is under 65.
Yep.
We are buying the insurance for her. Open
Yeah.
market.
Yep, go ahead.
And for myself,
Yep.
I applied for that one.
Right.
Part B. This process is going
Sure.
on. So it will be the no penalties or anything.
Right. No, because you were working.
So this I want to make sure I am on the
You're fine. You're on the right track.
Right direction.
You're perfect. You're exactly like me. I'm still working. My husband's under my insurance.
I will look for the job.
Yes.
because the
Right.
second,
Right.
Dodge thing or whatever they do.
Right. I say if they let you go, stop working. That's my theory. But,
In the first wave, I was there, but this one I got.
Right.
But still I am strong. I look for the job.
Of course.
But let's see what happened. But I'm doing this process, communicating with the Social Security or whatever.
Yeah.
they want
You
it.
applied for B, you filled out the B40 form, you filled out the
yeah.
L654, and it's the form employment form. You're good.
Thank you.
You're welcome. No, if you qualify for Medicare, you don't qualify for Obamacare. No, and you have to be a citizen. Yes, citizen, not president. You're no, you have to. You're a citizen. Yeah, no, you can't. You're right. Yeah, you can't get Obamacare, from what I understand. I thought you said president. Don't tell me you're president. No. Once you qualify for Medicare, Obamacare's out the door. That's for people that don't have insurance. And you can't get Obamacare to pay for your Medicare. You see what I mean? Doesn't work that way either. Okay, go ahead.
I have a specific question.
Yeah.
I'm 68 plus.
Uh-huh.
I'm working.
Uh-huh.
I hope to be working for next 6 months or so. At
Yep.
least, if not more.
And full-time, 20 or more people in your company?
I'm sorry?
20 or more people in your group health plan. Okay, good. Got it.
And my wife is not working. She
Okay.
has never worked.
Okay.
She is about 62.
Uh-huh.
62.
Yep.
She has never worked.
Uh-huh.
We both are citizens.
Yeah.
So I've never registered in any, A, B.
You never took A either. Yeah, you're like me.
Yeah, because my employer wasn't paying for my.
Yeah. I got it. Yep.
So am I missing something?
No.
Should I do something?
No.
I just heard
You're just like me. So when I leave my company, I'm the same age. I'm 68. My husband's on my insurance. Unfortunately, he's not 62. He's old, like me. But anyway, when I leave, he's on my insurance just like your wife. When I decide to retire, I will go ahead and take A and B. Right. Because A is the inpatient, B is outpatient, right? The other thing, will you have any retirement health benefits? Or once you're done, you're done? Do you have any idea? When you retire from your company, is there a retirement health plan or no? Okay, so what you're going to do is get A and B,